one thing that I always do warn patients about is it does interact with quite a lot of other drugs. And so it's always worth, if you are taking, this, obviously if you're having it prescribed, going through everything else you're taking with your doctor to make sure that the CBD won't do you any harm, really. But potentially what you don't want to do is mess up the levels of any other medicines you might be on. There are a few higher risk drugs. So I think, particularly warfarin, that's a drug that interacts with almost everything. But the other kind of broad groups of drugs that we'd be focusing on there are epilepsy medications, particularly drugs like carbamazepine, or Tegretol is the common brand name for that. And then certainly anyone who's taking antiretroviral medication for HIV, or people that are on immunosuppressant medication because they've had a transplant, those are very, very high risk groups, because those interactions tend to those drugs tend to interact with CBD in a very significant way. So I think the message there is always check with your prescriber. It's worth going through all of them. Most drugs we can find a way around it. For patients on warfarin, it's often just a matter of having slightly more frequent blood tests for a couple of weeks, so that there's usually a way around it. I don't think I've ever had to say, look, we can't prescribe for you, but sometimes we've had to adjust the doses of some of the other drugs that they're on a little bit, just to anticipate that interaction that might occur. Another natural product that works on the same liver pathway, St. John's wort, which a lot of people take for depression and mood, and that interacts with the same pathway in the liver that the cannabis medications do. So that's probably the main one I'd mention there to look out for.